Doctors say a new tool at Cone Health gives people more confidence that the drugs prescribed to them work as well as their doctors hope. Ben Patel is the Chief Information Officer for Cone Health. He says Cone uses a program called ACTX pharmacogenomic testing, which uses a person's genetic makeup to determine how well a drug works.
Everything that we're doing is truly personalizing the medicine and health for a person, for individual patient, based on your genetic makeup, based on your lifestyle, based on what's called the whole person care.
Patel says not everyone reacts the same way to a prescription drug, and an individual's DNA may mean that a drug doesn't work very well, doesn't work at all, or creates an unwanted reaction. By using a patient's DNA sample, doctors will be able to determine a medication's effectiveness or potential adverse reactions.
We're looking for a tool that will provide the decision support to our primary care physicians and other specialists who are not expert in genetics, and to be able to provide that tool so that we can help them guide to have the right medication for the patients, so that the efficacy, the safety, the cost, and all of that will improve, and overall it'll be sort of the right medication for the right patient at the right time.
The DNA sample can be done by collecting saliva at home or in a clinic, or by taking a blood sample. Patel says a conversation between a patient and their provider will determine if this type of testing may help. He says the exact cost of the test depends on a patient's insurance plan. So I think this is very neat. This is very awesome, because how many times have you gotten a medication from a doctor and you're like, I feel like it's just not working. I've been on this for a couple months now and I haven't seen an improvement.
It is just amazing what science can do these days. Like, we're almost headed to Star Trek, where they just scan you and know exactly what's wrong and fix you that fast. It's spectacular.
Yeah, science is an amazing thing. And I want to give you an example. So I asked him what kind of medications can this testing, show for, and he said a laundry list, but he talked about codeine and how that's often used to treat pain for some people. But he says the genetic makeup of some individuals, they can't metabolize that medication, so it's just not going to work for them. So if a doctor uses this testing, they can already know right off the bat, okay, this isn't going to work for this person just because of their gene makeup. Let's try something else.
It's amazing how fast the genetics research has advanced. I mean, like 10 years ago, the only thing you used it for was to find your ancestors.
Yeah.
It's crazy.
It's crazy, and it's just really awesome to see how this is going to impact patient health care, holistic care overall. So I'm excited to see what comes next. But again, if you're interested in learning more about this testing, just look for this story on our website.